the other thing, is that when we bring the fascia into the correct position, part of it not only could be shortened, but the other part could be very long, or too long to put it in proper posture. So that's something we have to take into consideration. So some of the other fascial impairments that I see commonly in my practice is an injury like a rotator cuff tear, trauma from a car accident, stress from your family and your job. You start to go into that enclosed position. Chronic pain like sciatic nerve. People will change their whole gait when they're moving because they're in pain. Falling, fell on the ice or off a curb. And we said posture for sitting, driving all day. When they're driving, one leg on the gas pedal, usually people are right hand dominant. So the right foot will be extended and the left foot. So they're shortening the left side and elongating the right. But when you go to stand up, then you're you're too long on one side and too short on the other. And that's when you'll get, I have pain in my back. And overuse of a muscle. For all my fitness people.
Yes.
Another big fascia. Okay, so
I think your drawings are great, Kelly.
You have such neat writing.
Yeah.
Do you want me to be your helper? I can be flipper if you want.
Oh, me.
You can tell I
Pick
can't
me.
sit still.
okay. So we talked about some of the fascial impairments, and we talked about how it's not going to show up necessarily on the bone scan, on the MRI, the CAT scan, the X-ray. And that's one of the main reasons people are always like, I'm in so much pain. What is going on? Everything's there, but why am I still in pain? And you'll be dismissed from the doctor. The way that you really need to figure it out is to feel the muscle and the structure of the body. You have to get in there and use your hands. That's what we're missing a lot of times. People just take a checklist and they go off of it and they don't really get in there and dig into the muscle and see what's going on. So how do we get rid of them? Myofascial release. So myofascial release is not massage therapy. We're not digging our elbows in and doing that. I love a good massage, but that's not what we're doing.
Thank you.
So for myofascial release,
Sure.
you said.
Sure.
Come on up, Anthony. Yeah, baby. Oh, the ladies are liking this. Woo! Ow!
Very sexist ladies.
Sorry.
It's a good thing I'm black because I would be red.
So with myofascial release,
You weren't kidding, they're cold.
you're gonna go into the muscle and you need to have the anatomy of the muscle. Like right now I'm working on the deltoid. So I'm gonna push in with a little bit of tension until I feel some resistance. At that resistance, I'm gonna back off and wait for the muscle to release. Now, as you get more and more practice, you can understand how much that shoulder is going to move. I'm going to look at his pectoralis major and minor. Bring your hands up, flexion, 2 hands. All right. And come back down. So I'm looking at the structure. Are they balanced? Are they together? Or is it at the top? He's bringing his head down. It's okay. He's been. No, it's been done.
Kelly's fixed him more than once.
Definitely.
Well,
Yeah.
you can tell them if you want.
Sure. So the way I came to know Kelly is I just retired as the chief of police for the city of New Haven, But back in 2006, when I was an officer, we were pursuing a suspect who had a shotgun in the car, and we had him trapped at gunpoint behind a fence, and rather than give up, he accelerated, crashed through the fence, hit me with the car, and that's all I remember. When I woke up, I was paralyzed on my right side, and basically for about 2 years had no use of my right arm. Was told,
when I met you.
so when she met me, literally the arm was just basically hanging down. And of course, as she was talking about, it changed my gait. So even though I got injured and had a head injury and from landing on my head and was damaged in the arm area and the arm would hang down, I would have pain in my hips. Like, but I didn't get hit there, but as she's saying, it changes the structure of your body. And so over a period of a few years, I was able to work with Kellie, and Kellie, through myofascial release, was able to the point where the neurologist was saying, "What are you doing?" And I was like, "Oh, I found this new lady. She knows how to do this thing. I don't know really what she's doing, but it's working." And he was like, "Well, I don't care what it is, just keep going." And at one point they told me I needed to retire, but through the work she did, I was able to continue with my career and ultimately ascend the ladder and become the chief of police.
Awesome.
So that's how I've known Kellie and continue to.
10 years ago.
10 years ago.
Wow.
10 years ago.
Wow.
So with myofascial release, we're breaking up scar tissue, which we had to do here. There's a lot of injury. We're releasing restrictions and mobility, and I'm improving the quality of the fascia so that it's moving smoothly. As I bring the arm up, I might feel a little click or a muscle pull that's telling me where I need to be, what muscle I need to work on, and provide the myofascial release. Okay?
No, decent. Another thing that has been helpful is I retired as the chief of police from New Haven, but now I work as the assistant chief of police for Yale University Police Department. And one of the biggest issues Kellie helped me with myofascial release is after an injury, your body changes, and through that release, she helped me because part of my uniform is wearing a bulletproof vest. And that vest weighs about 5 to 7 pounds and is constantly weighing down.
Right.
My body has to adjust to accommodate for the vest, and I would find myself feeling like I'm in pain.
Here, trigger point.
Because it literally rests on the trigger point. And so she helped me with that to be able to continue in my everyday activities with work.
Raise both hands up. Okay. Do you see they're more even now? Before, this one was having more restriction. It was down here. Now he's gained about 10, 15 degrees, I'd say.
Yeah.
Okay. Good.
No problem.
Hey, Kellie, I think one thing, I don't know if you mentioned this. Thank you, Anthony. One thing I think some people that maybe shy away from massage therapy because maybe they don't want to remove clothing. So maybe you can tell people if they were coming in, or maybe you didn't get to that part yet, if I'm already jumping ahead, but how you don't.
Generally, when I see people, the only thing that they take off are their shoes, their belt, or anything that's constricting, jewelry, something like that.
Yeah.
But other than that, I can move them around unless they're wearing something that's very heavy or bulky.
Like a coat.
Yeah, like a coat. I'm not going to treat you
Sweatshirt.
with a coat on.
I can tell you, I did go see Kellie once, just like I texted you on a Friday night and she had an appointment at 9 o'clock the next morning, not knowing what to expect. I think it were leggings, you know, and I thought maybe I'd have to, like, when I go to massage therapy, and she, through my clothes, like, completely fixed my pain. It was all just with her hands and through everything that I had on.
Yep,
So,
same with me.
it
Yep.
was amazing.
Yep. Got a lot of believers in here.
So the other thing that I work on, which I wanted to touch on because it relates to myofascial release, is craniosacral therapy. Now this goes hand in hand very well with craniosacral and the myofascial release. Craniosacral is a gentle, hands-on approach. It's focused on improving the central nervous system. So can anyone tell me where the central nervous system is located? And in the brain. system, of course, it has nerves that are running all through the body and innervating every section. All right, thank you. So how I stumbled on craniosacral therapy is when my daughter was born, my second daughter was born in 2009. She was born, sorry, I'm going to grab some pictures to show you. She was born with torticollis and plagiocephalia. Now, what is that? Plagiocephalia is when your head is not formed correctly. It's a different shape. And then she also had torticollis, which was shortening of the neck. She had severe for both. I'm going to show you a picture of her. It's hard for me even to look at it, like it's so bad. But this is what my daughter looked like when she was born. You can see how she was very turned.
Oh, wow.
That's not her turn that way. She could not bring her head to the other side. It's fine. But she was in pain, and it was hard for her to do things, and she was delayed because of these things. How I came into craniosacral therapy is the first thing the pediatrician told me to do was go get a helmet to fix her head, squeeze it back into shape. So, being the good mom, I went to get a helmet, and I had the same Master's of OT degree that the lady did that was evaluating, and I saw her mismeasure. I got scared, and I picked my baby up and I left. And I went back to the pediatrician and I said, I don't like this place. Give me another place. He said, I'm sorry, there's nothing else. And I said, what? So I started networking. I called my OT and PT friends. I said, what else is there that you can do to help a child with plagiocephalia and torticollis? And they said, well, you could do PT, but there's craniosacral therapy. And I'm thinking, what is this? I've been an OT for 7 years. I've never heard of this. I've never even heard of a craniosacral therapist. So I started researching, and I found a therapist, and I brought Leah to her. And slowly I watched Leah get better. So these are some pictures of Leah.
She's so
She
cute.
was 6 months,
so cute.
and here she's 2. And you can tell
See
she
the
looks
cute
like a
pictures.
different
Oh
child.
my God, she's so
She's able to
cute.
turn the neck now, full range of motion. And what she had was myofascial release and craniosacral therapy.
Wow.
And did you?
Oh dear, she's so
No,
cute.
at that point I was not trained in it. So I was hooked. And I also saw, as I'm paying attention to my daughter getting treated, I'm looking around and I'm seeing these people are getting better faster. So a typical rotator cuff tear they might be in for 6 weeks. Some of these people were getting better in 4 weeks, or they were at the same range of motion at 4 weeks instead of 6 weeks. So I'm like, what is going on here? This is interesting. So I threw myself into craniosacral therapy. I took all kinds of classes, certifications, and everything. Fell in love with it. And I really, really believe in it because it's the whole body. You're treating every single nerve ending in that body. And everything comes from your nervous system. So with a combination of craniosacral and myofascial release, you can get excellent results. So
These probably get Nancy. Do you want to make her model again or something? She's been sitting still for a while.
no, she's talking.
Oh, she's talking. Oh yeah, of course.
All right, so the last couple things I want to touch upon is when people are in a heightened stress level, they tend to get into that fight or flight mode. And people who have sustained trauma, whether it's accidents or PTSD, they're really high on there with the tension. And they might come on the table and they say like, oh, I'm relaxed. But you touch their muscle and they are very, very tight. So, you want to lay down?
Sure.
So sometimes when I'll see this, they'll complain of their stomach hurts, they're having digestive issues, heartburn, migraines, headaches, chronic pain, and lots of muscle tension. So when I'm doing craniosacral therapy, it allows me to bring that central nervous system down. Get out of that sympathetic, that fight or flight, I'm leaving. and get into the parasympathetic, which is more of a calming area. And 95% of the time we're supposed to be in that. But because of all the stress of our daily lives, and then to add to it, you get in an accident or something, you fall or whatever, it just really adds to it. So one of the most popular holds, I'm gonna do the occipital lobe. You can bring your chin up to me. There you go. Okay. So I'm not gonna have you try this at home. But this is one of the holds. Now how does that feel?
Pretty good.
That is bringing the occipital lobes, which are, this is George. So here's the face. Turn him over right here, back here. There's a lot of pressure, and your spine is going right here, that can form on the back here. So one of the ways that you can release some of that is a still point inducer. So you're going to put this right under here. Good? Okay. And this is something you can buy on the internet, and it's a couple dollars, but it can promote relaxation because it's giving you a little bit of relief on that occipital lobe. You could also do it with a towel and bring your head, roll the towel up here and bring your head into a little bit of extension. Will have some of the same effects. So I recommend this for patients who have very high stress, to do this for like 10 minutes every morning, and it really helps out. Or at night, whatever you can do. Is it hurting you, or you
No.
tell them it's good?
Yeah, definitely good.
So basically, I'm bringing that system down, that central nervous system. I'm getting him out of that fight or flight. I'm getting him into the calming down situation, and then I can move those muscles. I can do the myofascial release. The fascia is going to stay more in place and allow me to align them better because now they're relaxed. And they also feel better. So some of the things that come with craniosacral therapy, the side effects, are that your range of motion improves, increase the sides, your pain goes down, increase the body alignment, you sleep better. Who doesn't want to sleep better? And just overall better well-being throughout that whole body. So I showed you one of my gadgets.
Exactly. Feel good.
I'm just going to show you two more things that I use.
Oh, I want the massage stick. I'm jealous. Can you use it on me tomorrow, Kelly? All right, thanks.
So this is just a roller, but I really love it because it has water in it, and it's naturally cold. Really, it's cold. But you can put it in the refrigerator too. Not the freezer, the refrigerator. So if you know which way the muscle is striated, you can gently apply pressure to it. You don't want to dig in there too much unless it's like a large area, large muscle. But even doing this can help break up the fascia so that it can move again. Do you feel?
Yes.
Good night, Faye.
Yeah. So this feels great, and I'll pass this around if you guys want to.
Where can you get that, Kelly?
Online.
At Walmart.
Oh, really? That one at Walmart?
Yeah.
Oh, wow.
Yeah.
Walmart's stepping it up. There you go.
Yeah. What is it called? It's just a roller.
They have them, like, they call them tiger sticks too, and
Yeah.
there's all different names for
There's
them.
all different names and things, but the important thing to know is that you can't take a muscle and start digging into it in different situations or different ways. It's going to cause scar tissue. It could cause nerve damage. So you want to make sure that you're not digging in too much. Always go lighter than you think. This is another thing that you can kind of desensitize. If you have an area, roll it. This is nice to get on your shoulders, like that. And then these are my
Oh yeah, I want to play with
circle.
those. Yeah, those are
I
cool.
love these things. I got them for Christmas. I was so excited. I know.
Oh, they match my studio. You'll have to leave them here.
So, what you can do with these is this allows you to get into a position where you can roll out. So if you wanted to roll out on your knee, like underneath, You could even bend. It also helps, they were designed basically for yoga, when doing yoga, so that you could, if you couldn't get all the way into that position, you could put this here. But what's nice about this is instead of using like a therapy ball, this has a padded surface, so it stays put a lot more than the ball rolling away.
Yeah.
And it protects. So I also love to do a back bend on this. You wanna try?
Right here. Step right up. I'll do it if you don't want to. Babe.
Right, but I didn't know if I had to be. Oh, I got you.
Alright, fine.
Oh, watch your ponytail. Watch your ponytail.
It
Nice
feels
shot.
so good though. Now come back slowly. Back down.
So you're putting the spine into extension, right?
Yes.
Yep. Good job, Faye. So many talents.
But when you you said you wanted to be the
Say yes to anything. You gotta watch it, yes.
So if you guys want to look at that. Thank you. And it comes in one other size that's a little bit smaller than this. So that's it.
Nice job.
Any questions?
Questions?
I always have 100 questions.
Oh, go ahead, Tiff.
So, obviously, like if you went to book a session with you, you would determine what would be more beneficial, the cranial or the myofascial, or?
Yeah, I tend to do a mixture. I just
Combination,
go with
yeah.
the flow.
Oh, okay.
What I'm feeling with the body that day.
Okay.
Versus someone comes in, they have a script for a specific thing. I want to feel what's going on. I don't want to just go by a piece of paper.
Okay.
So that's how I practice. I definitely, the patient always has a lot to say in their treatment, which I love. That's why I practice privately. So if you tell me, oh my gosh, that craniosacral session was wonderful, I slept so well and everything, I'm going to make sure that I do the same techniques again so that you have that.
Mm-hmm. Yeah, I was just curious because.
Yeah.
Just sign out, like I didn't know if you had to
Yeah.
specify or whatever.
No, you can if you want, or you can, that's totally fine.
And then
Okay, go.
so like, so once you're fixed, like how long does it last?
It depends on the person.
Yep.
Okay.
First of all, their nervous system, how they're reacting, do they retain it? It depends on how relaxed they are on the table and how their body responds. So I never make any promises. I just do the best I can that day with them. But you never know how life is going to affect that day. They could come off the table and they stressed out for something else. But the more you can bring that central nervous system down and be able to relax, the better the therapies will work.
Thank you.
So I don't recommend going out and doing some kind of like exercise after having craniosacral. You should go home and sleep.
Yeah, that's what I did. That was great. Good night.
I feel so relaxed.
Yeah.
That.
And sleep is when you heal.
Yep.
Right.
And then is there anything that works in conjunction with it? Sorry, like PT, OT, acupuncture, like is there
Good-
stuff
good
that
question.
you can kind of like,
Yes.
that, something that will undo it? Is there anything that will undo it per se, or not necessarily?
I think it'd have to be specific to the situation.
Okay.
You'd have to ask me, like, it depends on the part of the body, how big the muscle is, how much movement it has, how quickly it inflames. If someone inflames very quickly, I may say don't do that movement.
Yeah.
If but ultimately the choice is up to you.
I'm just complicated.
No, but this is kind of what we were going to talk about in our wellness forum at the end of the month, is how the different modalities work and how they can work together. Obviously with what Kelly does, she can help with range of motion. Also a chiropractor can help with range of motion. So, but they do it differently. And so different modalities will work better for a person with their body at different times in their life,
Exactly.
or a combination of both.
And that's
So.
a characteristic of a good therapist when they say, I can't, this isn't working, I think you should try, and you refer.
Right.
Whether it's chiropractic or whatever, that's a sign of a good clinician when they say, this isn't working, and they're humble enough to say that, and they pass you on to someone who they think could help you.
Right.
I just have found the people that I've been seeing have been very open to everybody trying to
That's
treat
good.
the
That's
body.
what
And
we're
they
hoping
say,
to do.
I don't
Yeah.
have all the answers.
That's a good-
Therefore, I
that's
think
a-
Dr. Tracy told me that.
That's
You
a good
should
therapist.
be
Yeah.
Seeking all that
Absolutely.
and
Yep.
trying to turn to the more holistic things rather than
Yeah.
patients.
Right.
No doubt.
you have a question?
I did. Kelly, how long will like a session usually last? Just curious.
It's 60 minutes of direct treatment.
Okay. And it's a mixture of like you probably start with the craniosacral.
It depends. I usually do like a quick assessment of the body and see where you need treatment faster and where you need it the most is what I'm trying to say. And then I'll go to that area and then we'll work.
Sometimes you,
Telling me.
and sometimes you end up in a different area than
Yeah.
what's bothering them.
A lot of times when they tell me the knee is hurting, it's really the hips that are out of alignment. Or if the shoulder is hurting, it's really, or the shoulder's hurting, it's really the neck. So.
I just want to say one quick thing to that point, if you don't mind. One of the good things about Kelly is that, like she said, sometimes you think it's one area and it's not. Like, I remember coming into you one time and I just laid there and you said, I sense there's something going on in your chest. And sure enough, I hadn't told you, but like I was having chest pains and things like that. So, she's kind of like in terms of familiar with what's going on as well in the body, you can kind of sense that, right?
Yeah.
So when it comes to special needs kids,
Yeah.
I remember you mentioned about your daughter having delay and
Yes.
things like that.
Yes.
So we have done sacral therapy before for Vasich and my second son too. So we had somebody call. I used to drive. I wasn't in Norwalk. I used to drive an hour to see Dr. Faulkner, who was here,
Yeah.
who was bringing language more from a child who was. I'm wondering if there's any technique. She's retired now. She's not.
I know.
But we just moved recently to Wallingford.
Yeah.
But do you know anything that is specific to delays and why MFR and not MNRI? Do you know of any difference? With your experience as a mother having a
Yes,
as a child
yes.
delay?
I've worked with peds for 17 years, and I've seen wonderful progress with kids, especially with the autism population, and bringing that central nervous system down again. I've seen more language, more able to express themselves of what's going on.
Yeah.
I've had kids that were just running around in my room and jumping on the table and screaming and yelling, but we worked on everything. The sensory integration, the craniosacral therapy allowed them to be able to start talking and tell me what was going on or what was happening with their body. So I've had great luck with that.
Okay, ADHD as well.
Yes.
Okay.
Yes.
And I want to say something beautiful as well, because we came so late for Zumba class, but cranial sacral therapy is something I've been looking yesterday. Is like anybody nearby?
Oh, good. Woohoo!
Oh, someone's right there.
There you go. That worked out.
And you mentioned exactly when I came about this, the delay in child you brought. I'm like, oh my God, you got the right person. It was good that I came so late because my son can handle only half an hour around at some place.
Yeah. Yeah, and that's okay.
Yeah.
Yeah.
So, where do you locate? Do you visit Connecticut or can you tell
I'm
me?
down here on 80 South Main Street. It's called Therapeutic Healing. It's 2 blocks down. So, yeah.
Is it in the back building?
Yes. Yes.
Right next to Car Beauties, right?
Yes.
Yeah.
Can you repeat that address again? Sorry.
80 South Main Street. I have cards.
We have cards for you.
Yeah. I'll leave them up here if you want one. And feel free to call. You want me to pass them around? Yeah.
You got a question in the back?
Yes, one quick one. I heard you mention the word script. You find allopathic doctors will write scripts for what you do.
I used to take all insurances and I did all of that, and I found that it really limited me to a specific body part when I treat the whole body. So I eventually decided I really want to practice and have the patient very involved with their therapy, and they can dictate how long they want to come to me or when or how much they can afford, rather than someone else.
And my other question is, we have a lot of, I think, young people here. Fascia
Yes,
and aging.
yes.
How does fascia age?
It starts to get a little bit harder, just like everything else.
So the responses to the therapy would take longer than they might in a young
Not
person?
necessarily. It depends on what you've been doing in your life, how many injuries you've had, how well you're taking care of yourself. But it depends on, everyone's different.
Right.
So you could have amazing results in one session, or it may take 3 to 5 sessions to start feeling
I
really
just
good.
think this might be really something helpful for people who have had knee replacements. Because I think those for there we have the new lady right there.
Yeah.
One time, because I found that.
Yeah, you're totally right.
Yeah.
Yes, yes.
Would this be a treatment appropriate for somebody that has an autoimmune disease called scleroderma? That's where the fascia and everything, the connective tissue
Yes.
tightens so much?
Yeah. It would depend on the level they were at, how long they had.
Good question.
Okay.
I got 2 more.
Oh, 2 more questions?
I've
No,
got a
no,
couple
2
more,
more,
hold on
raffle.
1 second.
Oh, okay.
Oh, we got questions. Good. I love inquiring minds want to know.
While they're coming up with their questions, one of the things I wanted to emphasize that Kelly spoke about is how she assesses a person's body. She's not taking it, you know, when I came in, it was like, oh, I got pain in the neck, I can't move, my arm, this and that. She tells me stories now because we're friends, and she was like, you kept repeating the same thing over and over. I didn't realize that it was part of my head injury. But another thing that I didn't realize is how worked up I was. In order to sleep, I would literally wake up, watch the sun come up, sun go down, sun come up again, sun go down. And the only way I could sleep was by taking Ambien. And it would literally just knock me out. And once I started seeing Kelly, she was treating me for my injury, which was mainly my brachial plexus, my neck, head, arm, etc. But she was also started doing the craniosacral therapy, and that literally got me to a place where my body could relax enough. Because when I got hit, I don't remember getting hit. I don't remember any of it. People have told me what happened. So I'm like, how can I be worked up from something I don't remember? Your body remembers.
Muscle memory.
Your body remembers what happened to it. It remembers being in this fight or flight mode. It remembers, you know, all of those things. And it wasn't until she started the craniosacral therapy that I could calm down enough to be able to sleep without any medication. So she really does take a comprehensive approach to where is this individual, what's going on with their body.
Thanks, Anthony. Got a raffle prize.
All right, this is for 1 free session with me. And Jan Lyon.
Woohoo!
Llama.
And why don't you pick another winner, and they're going to get 1 month of free small group training
Okay.
at the studio.
Roxanne Lashine.
Woo! Roxanne, Roxanne! All right. Thank you, Kelly. Anybody else?
Guys.
All right.
Thank you.